Hello everyone, welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphoedema physiotherapist and SO accredited exercise physiologist. In this video we're going to cover the topic of is shaving okay after lymph node removal? This is a question that pops up all over the place, particularly on breast cancer forums, particularly if you're at risk of lymphedema. So if you enjoy this content and you would like to see more, then please subscribe to my channel, which is completely free. Give the video a big thumbs up if you like it and leave a comment in the section below if you have any questions on shaving after lymph node removal. This is a topic that I may approach a little bit differently from a lot of people. There may be people out there who strongly disagree with my approach to the answer to this question, and that's okay. I think there are many ways to approach the problems that we face after breast cancer, but the way I tend to approach a lot of my responses when patients ask me questions is that there has to be a focus on quality of life. So we'll get down to that in a little while. But first and foremost, the question I want to pitch to those people who are wondering if it is safe to shave your armpit with a standard razor after breast cancer, or particularly after lymph node removal, is how often do you actually cut yourself? So I just want you to have a think about that for a second. The first thing we need to talk about in this video though is the concept around why cutting yourself after lymph node removal is problematic. Now, I recently did a video on prevention of cellulitis after breast cancer, so if you want to go and check that video out, you can follow this link. The reason that cuts and any sort of skin breakdown can be problematic after breast cancer is because of higher risk of infection. So anybody that cuts themselves, even if they haven't had lymph nodes removed, are at risk of an infection because it's a form of skin breakdown. When you've had lymph nodes removed, you're at higher risk of infection. And the reason behind this is because your lymphatic system is under the banner of your immune system. So take out a section of your lymphatic system, you're taking out some of your immunity. Now, specifically speaking here, when you remove lymph nodes from an armpit, you're reducing some of the immunity on the skin of the arm that's had the lymph nodes removed. So we're not talking about immunity of any other systems, we're talking specifically about immunity of that arm, and we're not talking about the immunity of the skin on other body parts that haven't had localized lymph nodes removed. So just keep in mind that this is a specific area of your body and it's a specific system of your body, being the skin. So if you get a cut on that side, then you do have to monitor it for signs of infection. It's a sensible thing to apply an antiseptic ointment to that area and keep it clean and dry. So a cut is an entry point potentially for bacteria to get into your system, which ultimately means it's a risk of cellulitis, which is a broad skin infection, but it's also a risk for triggering lymphedema, which is why we are concerned with skin breakdown or cuts when it comes to those people who have had breast cancer who've had lymph nodes removed. So back to the original question that I pitched at the beginning of this video, which is how often, for those of you who do use a razor to shave your armpit, how often do you actually cut yourself? Now personally, I haven't cut myself under my arm for a long time when using a razor blade. Now that may not be everyone's story. So to answer this question, I'm going to put it like this. If you're someone who nicks yourself or cuts yourself with a standard razor on a very regular basis, you may want to consider other options for hair removal in your armpit if you've had lymph node removal. However, if you are someone who has never or barely ever cuts yourself under your arm when you're shaving and you've had lymph nodes removed, then this may be quite a safe form of hair removal for you personally. The reason I state it like this is because, again, we need to focus on your quality of life after you've completed breast cancer treatment. If you're under the impression that so many things that were used to be normal activities are now removed from your daily life just because you might be at risk of cutting yourself, which means you might be at risk of lymphedema, which means you also might be at risk of cellulitis, is possibly not the best way to live the rest of your life. So that's the way I approach this particular question And I hope that that resonates with some of you, because we've also got to consider that you could cut yourself in the kitchen accidentally using a sharp knife. You might accidentally burn your arm on a hot pan. You might get bitten by a cat. You might stub your finger on a rose thorn. So there are lots of opportunities that can occur in daily life that could potentially mean skin breakdown. And so if we look at it like that, if you are using a razor before breast cancer treatment or before lymph node removal and you barely ever cut yourself shaving with a standard razor, then potentially that is a safe activity to continue with, particularly in the context if you use shaving cream and you're performing the shaving in the shower, so there's water, which means that there's less risk of cuts or abrasions by the razor. It's probably a good idea to keep your razor being turned over on a regular basis so that you don't have to apply heavy pressure with the razor, which could also increase your risk of a cut. Consider also the other types of hair removal, being waxing or laser. Waxing and laser still have their own set of risks as far as skin breakdown or cuts are concerned. Laser can put you at risk of a laser burn, and waxing can certainly put you at risk of a cut or an abrasion. The other thing to consider, of course, is that if you have had chemotherapy or radiation, the sensitivity and or fragility of your skin under your arm may also be at higher risk for cuts if waxing is being performed. Please also consider the fact that you do have the choice not to perform hair removal at all, but for many people this doesn't necessarily feel like an option, because in current time most people, particularly women, prefer to have a shaved armpit. Now that's not everyone, and everyone's individual choice is very important, but just consider that the big picture is that if you barely ever cut yourself with a razor, and you can reduce your risk by replenishing the blade of the razor on a semi-regular basis, using shaving cream and performing this with the use of water, then you're cutting down your risk of cuts anyway. And in comparison with other hair removal techniques, shaving with shaving cream in the shower might actually be a safer option than others. Thank you so much for watching this video, guys. I hope you've gained some really good information on shaving your armpit after lymph node removal or breast cancer. If you have any questions, then leave a comment in the section below and I'll get back to you as quickly as I can. I'm looking forward to some of my upcoming videos, including my recent video that I shot with breast care nurse Janine Porter-Steele on reducing the impact of hot flushes. So watch out for that video in the coming weeks. Hope you're having a great week wherever you are. I'm Jen McKenzie, the breast cancer physio, and I will see you next time.